Good morning. On this Thursday, August 6th, welcome to the Doctor's In Ask Dr. Arwady. I am Sybil Madison, your Deputy Mayor for Education and Human Services. Very delighted to be here with Dr. Allison Arwady.
Hi, everybody.
Your Commissioner for the Chicago Department of Public Health. This is where you can get your questions about COVID-19 answered, and we'd love for you to put those questions in the box below, or you can use hashtag AskDrArwady on Twitter or Facebook to get those questions to us. We always start by checking our distance. We're doing good with our physical distance today. And I guess I'll just turn it right over to you, Dr. Arwady, to give us the latest.
Sounds good. So thanks everybody for joining. Obviously, the big news of this week was the decision for Chicago Public Schools to go entirely remote for the first quarter of the year. So if people did not see that information, although I'm sure it got out pretty widespread.
It was all over the place.
It was all over the place. You can see there was a press conference yesterday. There's been information or Tuesday. There's been was it yesterday?
It was yesterday.
It was yesterday, thank you. The days are all running together. Yesterday, and then information in the news about that. And I'm sure people are going to have questions, so I wanted to just maybe start out again by talking a little bit about what that looks like, and we'll do that in conjunction actually with looking at the data dashboard. So as always, we're going to go to chi.gov/COVID-, or you can get there by our regular chicago.gov/coronavirus page, and then right up at the top under latest data. So when we pull up the dashboard, we got it up? So right on the default page here, where it comes, we see up at the top our current positivity rate, and that is calculated using the way the state of Illinois is calculating percent positivity. It's a new addition to our dashboard. Previously, we've always been including percent positivity calculated by the number of positive tests divided by the number of people tested. The state instead uses the number of positive tests divided by the number of tests done. And so given how much attention there's been on percent positivity, we wanted to add that to the dashboard. So that's what this 4.8% is at the top. Over on the left here, if you go back to daily by demographic, this is what we've always had. We have kept this in place. This is about the number of people, the percent of people who are positive. And you can see we're at 6.2% there. So we are tracking both of those figures, but the 4.8% is the one that is really being discussed and for comparison around the state. In addition, let's look at our number of confirmed cases. And you can see we are at 287 cases per day on average that we are now adding.
New cases.
New cases per day getting added. And if we look at sort of our graph here, the concern, of course, is that this has continued to trend up. And so where I'm highlighting here, this is our rate, our case rates. And so this is where we correct for population. And you can see I'll just show you how to do this. Say if you just look at the last, let's say month or so, if I take it back to the beginning of July, give or take, it will update all of the data to that time period. You can see that we've just continued to add cases here, and our case rate has gone up. And the concern is that when we were planning for Chicago Public Schools, CPS is one of the biggest school districts in the nation. About 360,000 children are educated through CPS. So absolutely enormous in terms of planning needs. Mm-hmm. And we had set really, as far as planning for CPS, that if we were at a point here in Chicago where we were at 400 cases per day, or if we were at that over 200 cases per day with concerning epidemiologic factors like rate of increase, like percent positivity, that would be the setting in which we would not move ahead with in-person instruction. And the concern where we look back over the last month is that we're at nearly 300 cases a day right now at 287. And just 4 to 5 weeks ago, we were consistently under 200 cases, and we were as low as the 270s. So where we've added more than about 100 new cases per day to our number over the last month, and you can see from this graph, unfortunately, we've not shown a sign of turning that around yet. The worry is that if we continue to add, even at that relatively slow rate compared to what we were at the beginning, a month from now, we would potentially be at or near that 400 case mark. And we really felt, we've been looking at this data, having conversations with Chicago Public Schools and many folks. Obviously, it's a huge decision. We felt like it was important to make the decision really at least a month out in terms of making sure everybody has the time for planning. And so recognizing that we were in that 200 to 400 range and on the way up, the last thing that we wanted to do was to say, let's move ahead with hybrid model, and then a month from now be in a point where we needed to pull back on that. So it is, personally, it's a little disappointing. We do feel pretty strongly that there are real benefits to children having in-person education, and we've talked about some of those. We also know that kids get a lot of needs met through schools, particularly in a large system like CPS, that are just hard to meet virtually. But the other piece was, there's the data piece and where it fits in, but the other piece is that, we heard from a lot of parents and staff and principals that, broadly speaking, a lot of people were just not feeling comfortable at this point with moving ahead. And so in terms of the conversation and the decision making, we felt like it was the right thing to do to make that decision for the first quarter. We are very much hoping that we will be in a better position from a data perspective. We'll hopefully have seen that come back down, be in a better place, and hopefully parents and staff and teachers will actually have the opportunity to see how this goes. We'll all have the opportunity to learn from places around the country that are moving forward with in-person instruction. I want to say that I am very supportive of in-person instruction where the local data, the local outbreak supports that. I'm hopeful that New York City, for example, will be able to move ahead. They've said as long as their percent positivity stays under 3%, they're planning to do that. They would be really the only very large district moving ahead with in-person education from the beginning of the year in a similar hybrid model. And I hope that happens because it will give us a real opportunity to learn what that looks like in a big system where the outbreak is broadly in control. I am very concerned about the fact that schools are moving ahead with reopening in places like Mississippi, where the outbreak is more than 4 times as bad as it is here. It's almost as bad as we were sort of back at the peak. And yet there are schools moving ahead with reopening. I am not in support of that. So I think we're going to be seeing a lot of news about schools really just over the next couple of months. And there will be cases and there may be some spread, especially in places where the outbreak is not good. But it will give us the opportunity to continue to learn about risks and benefits and the ways to do this as safely as we can.
And you mentioned yesterday that we have smaller settings here in Chicago where we've seen youth and children return to spaces, and in those smaller settings, we've seen some good stuff happening.
We've seen, we've been following really closely our camps. Parks has had programming open for kids in the latter part of the summer. We've been following really closely childcare settings, daycare settings, and we've seen individual cases in those settings, certainly, but we've seen very little spread in those settings. It's typically an individual, and it's usually an adult, not a child, who picks up COVID somewhere outside of the setting, but then obviously if they're in a setting, we're following up. And so, I do think that the plan that CPS has put forward remains very robust. It's a good plan because it allows us to move into different phases depending what's happening with the outbreak and what's happening in terms of what we know about risks for kids and adults and the ability to have relatively safe school environments. We've seen all around the world places where schools have been able to open very successfully. Those are all places where the outbreak has been in good control, though. So more to come. We'll be following on it, but I wanted to make sure you all knew that this was in no way me feeling not confident with the safety plan, that CPS has, the ventilation, lots of pieces that are in there. But just in terms of feedback from the folks who are, in this system, combined with concern about just where our outbreak is going, we did make that decision for the first quarter. I hope people see this as a little bit of a wake-up call in Chicago that we are not where we need to be from a COVID perspective and have not been able to turn that curve around just yet. It's not the urgent, it's not the very steep increases that we've been seeing in other parts of the country. In fact, our rate of increase has been, less than half what it was the first time around. But the problem is that even one that is half as fast, you'll still get there, to potentially a bad place. It just takes twice as long. So we're watching these numbers closely and with some concern.
And it's an example of how our individual behaviors impact not just ourselves, but so many others.
Totally. And we'll need to be thinking a lot about safety related to COVID in settings where young people and older people, where everybody is going to be getting together outside of school, where you probably don't have as much oversight of the masks and the social distancing and a lot of those controls. Big decision, and I think definitely the right decision given where we are right now, but still just disappointing that we're at a point with COVID, even here where we've broadly been doing quite well for a long time, that's the direction we've had to go. If we look at the rest of the data quickly, you can see deaths have really remained, I'll click here, came down and have been, let me pull this back out to a longer time frame, have come down and really remained very flat here. We've been at just 3 deaths a day, for quite a while, and before that at 4 deaths for quite a while. Like we've not seen major impacts on our hospital system at this point, which is very good news. You can look on the data dashboard. You can see the hospitalization data if you're interested. Though that all looks good, so we've not seen impacts there. If we look by age, again, if I go back to cases and age, and I'm going to just change. I'm showing you also how you can play with this yourself. If I bring it up to about the last month here, this red line on the top, again, represents the 18 to 29-year-olds. The light blue line represents the 30 to 39-year-olds. The yellow line, the 40 to 49-year-olds. Those are our 3 groups in Chicago that are above the dashed line that is the city average. You can see, just these last couple weeks, or these last few days even, those 30 to 39-year-olds perhaps starting to catch up with the 18 to 29-year-olds. So we'll see. We've been doing a lot of outreach and work with those younger groups in particular, but that is who is primarily being diagnosed with COVID at this point. Given a choice, having more diagnoses in those younger groups as compared to our people who are over 70 and over 80 is better in terms of risk for hospitalization and death, but those younger folks can absolutely spread it.
In fact, the over 70 and 80 plus are the 2 groups where we're seeing a decrease.
That's right. Exactly. So older folks are doing a good job, and we need everybody to keep, if you're in those younger or more vulnerable groups, really continuing to doing everything we can to protect those younger folks. Let's look at the weekly data real quickly as well. So if we click here, we end all of our weeks on a Saturday. That's actually how epidemiology is done around the whole country. We talk about epi weeks in the year. It's how it's always done. So the most recent week here would be the one ending August 1st. And if we take a look at that week, this is where you can see, our confirmed cases were up about 3%. And actually, we continue to get sometimes delayed case reports coming in. We update the entire dashboard every night. And so I actually expect that will probably continue to rise a little bit. But as of what's been reported to us right now, we had almost 2,000 cases last week. Our number of people tested was down just a little bit. Again, that's people tested, not tests. The tests are actually up. That's on the percent positivity. And our people positive is also up to the 6.2%. But you can see deaths continue to fall, really down to 15, again dropping down from 40%. And then the map on the right here really says just for this week, where are we seeing areas of potential concern? This is just highlighting zip codes that had, again, the most cases, and so you can hover and see what's going on in a given zip code. You can also, if you go to rates, that will correct it for population. So you can see, again, that looks a little bit different. If you have, like this area down here has a lower population, so having some more cases in an area with lower population actually suggests some concern. So we'll be looking at that. And then, for example, percent positivity, you can look here, and if we click, here are the zip codes that the percent positivity is less than 5%, and that's using the person positivity, the one we've been using all along. You can see that broadly, those are our communities on the north side, although there are some others that are doing quite well there. Actually, Austin is looking really good. We've had a lot of focus in that area, so that's really good to see. In contrast, the zip codes that are more than 10% positive continue to really see that focus, especially on the southwest side, but also on the northwest side, and then a little bit again on the southeast. And then in between here, these are the zip codes that are kind of in between. And so these remain our focus. If we go back to the race ethnicity data here real quickly, let's just look at that a second while we're at it. You can see in blue here, we do just continue to see the most cases in the Latinx community, and that is rising. It's our biggest concern,
yes,
in terms of number of cases. Yellow are people who report other race ethnicities. Purple are Black non-Latinx. So you can see that both Latinx and Black non-Latinx have higher case rates than the red and the green, which are our white non-Latinx and Asian. But particularly that Latinx community remains just an area of major focus for the city and really for everybody in terms of making sure we're getting good messaging, good testing, good access to care, good access to resources out. The last thing I'll say is if we look at deaths in comparison here, and let me just pull this back, because the number of deaths is so low at this point that early on you can see in purple here much higher rates of death in Black non-Latinx, and that still is where we've seen disproportionate deaths broadly in terms of COVID cases. We have higher rates of the chronic diseases that make people particularly at high risk for bad outcomes from COVID. We see those at much higher rates in the Black non-Latinx community. But you can see that broadly all of the death rates have actually come down, very well, very, very well, to a point where we're, again, just seeing about 3 deaths a day across the city. I'd like to get that even lower, but it's looking good. And maybe just the last thing I'll say is that broadly at the whole city, up at the top here, you can see that at this point, 1 in 6 Chicagoans has been tested, and that is Chicagoans. That is not that's not the number of tests done. So that is true individuals that have been tested. 1 in 992 Chicagoans has died. That's in comparison to New York City, for example. 1 in 370 New Yorkers unfortunately died from COVID. But still, that's a lot of people. Yeah. And then our confirmed cases are at about 1 in 45 Chicagoans. And then you can look and hover over any zip code if you want to see in comparison, right, what that looks like. So lots of looking at the dashboard today, but I think it's a good way to have people understand some of what's going on.
And we don't usually talk about this, but we do have an estimate of how many people have recovered
from
COVID here in Chicago.
We do. So of our 62,437 total cases, we do have an estimate that 56,315 have already recovered. So that would leave out about 6,000 or so. And of those 6,000, about 2,798 have died, unfortunately. So that's about half. And then the other half, around 3,000, actively have COVID right now, in terms of they have recently been diagnosed, they are sick and in the hospital, or they are in their period where they're recovering at home. So just to give you a sense, the great majority of people have recovered. We're still learning about the potential for long-term impacts from COVID, but they've at least recovered from their initial injury, their initial infection, and that's what our current numbers look like.
Okay. All right. Questions rolling in here. From Margaret Quinn, Facebook. What specific actions will Chicago take to get our metrics to a place where CPS can reopen in November? Should we take steps back on reopening? What specific actions can we take as citizens? And thank you very much for asking that question.
Yeah. So the most important thing is that where we are seeing spread right now in Chicago is not in the settings that we were seeing a lot of spread in early. Early on, we had big bad outbreaks in long-term care facilities, just like we did all over the country. We still continue to have some cases in long-term care facilities, but it's broadly, they're in very good control. It's not a major point of concern, although we have not given up on the testing and the careful attention to that setting. Similarly, the jail had a lot of cases very early on. There was really aggressive work. There was actually a paper that came out that highlighted the work that was done at the Cook County Jail with many partners from CDC, from the Chicago Department of Public Health, from the Cook County Sheriff's Office, from the CIRMAC, the medical providers, and others, showing how we were really able to get that outbreak under good control, even at a time where cases were still on the rise here in Chicago. We saw cases early on in our shelters for people who are unstably housed. We saw some pretty big outbreaks in factories, meatpacking, other workplaces where there were not a lot of distancing. That is not where we are seeing cases today, by and large. We are seeing cases in households, and we are seeing cases where people are getting together socially, getting together with extended family, getting together with friends. People feel comfortable, they let their guard down, they stop wearing their masks, they stop social distancing. But the problem is that as society in general has opened up more, if you're moving outside the household, or anyone is moving regularly outside the household and not being really careful with masks and social distancing, you've got a higher risk of then bringing COVID back within the household. And so, I mean, it comes back, like literally the things I need people to do most at the individual level is wear your face covering, keep your 6-foot distance, wash your hands and do the hand hygiene, protect vulnerable Chicagoans. So that could even mean if you have been out and about without a mask, or you've been in a crowded situation, or you've had some other exposure, perhaps even at home for a for that 14-day period, you may need to be wearing a mask or trying to social distance from people, especially if they're particularly vulnerable within the household. We will see what we need to do in terms of making major rollbacks. If we needed to move back to take major steps back, like in a shelter-in-place kind of way, we obviously would not be able to open schools in a setting where we were in a shelter-in-place. So really the goal is to do what we, at this point, have been doing while we've been in this 200 to 400 new cases per day yellow zone of concern. We've been applying some more surgical measures. So you'll remember we closed the indoor bars. Yes. We pulled back on the number of people that could be in classes and fitness studios. We put limits on the number of people that can be visiting a given apartment, for example. We said no more spas or interaction.
Any kind of services where you had to take a face covering
If you have to
off.
take a face covering off, you can't have it right now. So no facials, no beard trimming. You have to wear those masks. We know that especially in a setting like getting a haircut or getting some of those personal services, you can't keep the 6-foot distance by definition, making the mask even more important. The mask is not 100% protective, but it helps a lot. And you know, I'll remind you that there was a lot of attention on a situation in Missouri where there had been 2 salon workers who were cutting hair and were then found to have COVID, and they had had 160 or so exposures. And everybody thought there would be a lot of spread because this was just as things were reopening. But they were wearing masks, their customers were wearing masks, and we actually did not see any spread in that setting. It got reported out by the CDC. Just a good example of, again, doing what we can to limit risks. So we may make some additional decisions here. We may do things like drop gathering size again, for example. If we needed to make bigger decisions, like closing other indoor settings, that would be a sign that our outbreak was really not in good control, and unfortunately we would not be in a point there where we would be able to move ahead with in-person school reopening. So the main thing is trying to turn this around by having people have fewer interactions that are not necessary, fewer interactions without a mask, fewer interactions where you can't keep the 6-foot distance. So getting people at that individual level to do the things that we know work. Obviously, we're going to keep pushing testing, especially to areas where we have concern for increases in cases, because that's a big part of it. We're doubling down hard on our contact tracing work and our case investigation work, getting more of that out into communities, but that's on the response side. Most of this is really about the individual level behavior.
And prevention.
Yeah.
Okay. A question from Facebook from Jeanette Pekansky. Why are Catholic schools opening?
So the planning that we did and the decisions that we made and those numbers that we cited were very specifically for Chicago Public Schools, because CPS is such a large, diverse, complicated ship to steer.
Yes, it's a Titanic.
It is a Titanic. And so again, knowing that we needed to be making those decisions at least a month in advance, where you're thinking about what all of this needs to look like, those are the guidelines that we set. I remain in support of schools being open where the community outbreak is broadly in control. And actually, our outbreak, we're in that 200 to 400 intermediate space right now. And where there are schools that are planning to open, in the next couple of weeks, we do remain in support of that as long as they have all of the appropriate precautions in place. And obviously, we will be following right along with them. We would expect to see individual cases again in those settings. The goal is not to see any widespread COVID, and that would also, give us some opportunity to really support and learn. My expectation is that this would likely go similar to how our camps have gone and how our a lot of our childcare settings have gone, which is really actually very well this summer.
Yeah.
So. Obviously, ongoing conversations there, but the conversation and the guidance that we were providing was specifically for the CPS discussion because of the amount of planning that is needed. And so, so we have not said that the Catholic schools or the private schools cannot reopen at this point. ISB, the Illinois State Board of Education, also does get a final say in terms of what that looks like. But here in Chicago, we're not imposing additional restrictions at this time.
Yep. And it is important to say that the leaders of those other institutions, the Archdiocese, et cetera, have been involved in conversations around guidelines.
Oh yeah, absolutely. Yeah, they've been looking, at the CDC guidance. They've obviously been in a lot of touch with the Chicago Department of Public Health. They've got infectious disease experts on their team. They also have good plans. Nobody wants to be setting up situations that we think would be significant risk for spread. But so the decision to move ahead, we are supportive of. We've not had a citywide mandate that education will not continue, and that's not our stance at this point. Again, I remain very supportive of in-person education where we can support that at the community level. Really, those benchmarks for CPS are around just needing to steer a very large ship and hearing feedback.
Yeah. And I think it's also important to say, even as we look toward in-person education for Q2 for CPS, that we're not in an environment where there will be no cases, right? There will be cases.
Yeah, I think in fact there may be as many cases from kids getting together in settings without all the precautions potentially, but there absolutely will be cases, just like we've seen individual cases in camps or in daycares. But if we've learned a lot about how to set up good environments that help protect against the spread of COVID, it's why we're not seeing big widespread outbreaks in workplaces like we were.
Yes.
And I am confident broadly in those plans. But if your level of COVID gets so high in the community, in Mississippi, my goodness, just your risk that there are all kinds of people with COVID, whether they know it or not, is just really high. That's not a setting where you want to even be running a risk, even with the appropriate precautions in place. But I think broadly, if your outbreak is in good control, if we were at this level and everything were flat or on the way back down, we would feel confident more that we were in a place to potentially be moving ahead. It's not just a question of data, of course. It's a question of feedback and planning and all of the rest of it. But it's more that we've been seeing this increase and needed to make decisions a month in advance.
Yep. Okay. At 20-somethinger from Twitter, why do we count cases in total and not unique people infected? If I'm positive and get tested 5 times, and 4 come back positive, that's 4 new cases, correct? Why wouldn't it be 1 because I'm a single person?
Yeah, no. Very good question. So you only get counted once as a positive case, for sure. That gets deduplicated everywhere. I have a whole team of epidemiologists. These data sets are so big at this point, it is taking many, many hours to do this work every day, but absolutely we do it. So we compare, there's programs that look at name, date of birth, basically do some matching, and within a certain time period, we only count people once with a positive test. The difference is in the denominator. It's whether you take your denominator to be all of the people tested versus all of the tests done. Again, not that one's right or wrong. It's just 2 different ways of looking at it. So yeah, good clarification there. You definitely only get counted once as a case.
Okay. Sherry Hill Trotta from Facebook. What do you think about ride sharing with windows down?
Oh, yeah. So I am a big I'm a big proponent of windows down in any setting where that is possible. So I think Uber and Lyft have actually made recommendations that as long as the weather allows to have windows down, anything that improves ventilation broadly helps for indoor settings. So if it's not pouring, absolutely open the window. You know, if you're at home, if you're in a setting and you can open a window, it's one of the easiest things that you can do to increase airflow and circulation, which we know helps. I think early on people were under the impression that it was better to seal themselves off from the world outside, but we know at this point that that fresh air is actually very good and helpful. And a lot of the plans, you know, under the surface, a lot of the questions that we get and a lot of the best work I think that's been done here in Chicago, both with big office buildings and with schools and with other settings, is the folks who are in charge of the ventilation systems really looking. There's ways to adjust those to increase the amount of airflow in and out, to flush buildings with air. A lot of that engineering kind of work is also happening. There's been clear guidance on that from CDC and others, and it's one of those behind-the-scenes environmental controls that can help. But regardless of the setting that you're in, opening a window is one of the best things that you can do. So I would absolutely, if you're in a ride share, open the window.
How does airflow make a difference?
Just in general? So we know that the ability to sort of have good air circulation moves air through a room. And so if you have a concern, if there is someone who is, for example, asymptomatic or even symptomatic from COVID, if they're not wearing their mask, or even if they're wearing their mask, there can still be a little bit of COVID that, you know, can escape. And especially if you're in a setting where there are people in close, you know, in a car, you might not always be able to keep that distance. Having additional airflow just moves any of those germs sort of throughout. And so that's one of the reasons outside is generally lower risk than inside. It diffuses anything people are breathing or coughing that are going out into the air. It gets them moving more, diffuses them through the air. Sunlight can help kind of deactivate it a little bit, etc. So it's just about having better airflow.
Got it. But it doesn't mean that this is an airborne.
Yeah. So
I just wanted to.
Yeah. So this is where, you know, I would prefer there is a technical term for airborne transmission. There are also clear examples of people transmitting COVID within rooms with each other. Rather than sort of parsing out kind of the details of that, you know, the risk remains clearly the greatest when people are within that 6 feet for the 10 minutes without the mask on. Like, that has been shown over and over again. I think we have more concern than we did, you know, months ago about the risk of potentially being in a room with someone, especially if there are not masks, even with some distance. And there have been examples of that. But at the end of the day, you know, this is all on a spectrum, right? People are always asking me, is something safe, is it not safe? I can never say something is safe or it is not safe. I can say, here are the ways to make it more safe or things that would be less safe. You know, something like being in a room, especially without having the mask and whatnot, having additional ventilation that helps move air through is one of the best things to do for that low percentage. Again, this is not like measles that spreads very easily, and when someone is in a room, there's a high risk of possible spread. But we're seeing some examples of spread in these indoor settings.
Okay. Emily Long from Facebook. What is your advice for a person if they get sick and want to avoid spreading it to the people they live with?
So this is where, first of all, you definitely want everybody wearing masks if at all possible. You want that person ideally staying and sleeping in a room by themselves. You want that person, if possible, using a bathroom that is just for them while they are sick. We know that is not always possible, so if that's not possible, extra cleaning is very important. Again, where you're cleaning, as long as you're not touching your eyes, nose, your mouth, not a major risk. And you would really want to step up the cleaning in that situation. So extra cleaning, you can just use the regular household products. We've talked about this before, but especially high touch surfaces like doorknobs or tabletops or faucets, light switches, and really try to have that person keep distance as much as possible.
Seems like the other people in the house should be washing their hands frequently as
Everybody should be washing their hands. The person who's sick should not be ideally sort of preparing food. Like, it's really about trying to keep that person as separate as possible. And then, situations where if there needs to instead move to a quarantine or isolation setting, right, there could be a possibility for that as well. But if someone is staying home, it's about keeping that distance as much as they can. The sick person should also not, as much as possible, be caring directly for pets. This is why when someone is diagnosed with COVID or we're doing the contact tracing, we combine the asking about their health and their connection to medical care and their contacts with asking about what resources they may need to be able to safely quarantine or isolate is technically the term if they're sick. Do they need support around things like food coming to them? Do they need support around even things like, their pets? What do they need to be able to isolate or quarantine as safely as possible? We have folks who help people figure that out every day on a daily basis.
Got it. And right now where we're seeing more cases among the 19 to 29-year-olds and even among those in their 30s, where we might have people who don't even realize that they could be positive. Right. It seems like these kind of within your household precautions, especially if you have an older person or someone with an underlying condition, might be good for people to do.
They might be. That's right. I agree. I think especially if you're living in a household that just has a lot of people in it, and if there are people who are older or have those underlying conditions, you do want to be extra careful. And if you are out and about, really important, no matter what age you are, to be keeping your distance, wearing your mask, doing the hand hygiene. And then if you know that you maybe haven't been entirely careful all the time, you really need to keep your distance from anybody at home who is at higher risk.
Okay. Tom J. Kalovos from Facebook. I think you're going to like this question, Doctor. What formula do you use from the data from other states to determine the 15 cases per 100,000 for the 7-day rolling average? And also, how does it look for Washington and Oregon? Okay. I'm looking to go out there in September. Okay. What do you think?
All right, good. So first of all, if you go to chicago.gov/coronavirus, right up at the top, we have a lot of information about the current status of the travel order, and we also have a map that shows you all of the states and how they're doing. So I will let you know that Oregon in particular is in very good shape. They're in that lowest category of number of new cases, and Washington is doing pretty well too, although they're a little bit higher. They're in the 10 to 15 risk. We have data there with the actual formula if you want to see the details of the math. But at a high level, let's kind of talk this through because I think it's important. So let's say we have about 270 cases, new cases per day here in Chicago. It's a little more than that, but to make the point of the math. 270 new cases per day in Chicago. We have 2.7 million residents in Chicago. So the whole point of this calculation is how many new cases are you having per day as compared to your population. So where we're having about 270 new cases per day in a population of 2.7 million, our rate is 10 new cases per day per 100,000 population. Does that make sense? If we were instead having 15 new cases per day per population, you would add 50%, and that's how we actually get to that 400 case per day mark that is our point of concern. So we use data from the CDC. All of the states have to report into the CDC what their new case numbers look like. We again went with new cases, which is pretty standard for what people are using. the way that these are being looked at across the whole country is with that correction for population, because it gives you a sense of where an outbreak is in good control or
It means
not.
that we can compare across
We
states
can
of
compare
different
across
sizes.
states, right?
Population.
And so any state that has that 15, we see how many cases have you had, right? Like what was the average number of new cases in the last 7 days, just like we do here, and then divide it by the population of the state from the last census. There's a good reason to do your census. And we then calculate it, and we update it every Tuesday, and you can go and see the details. So the idea is that these are places where the outbreak is not in good control. At the federal level, just interestingly, we started doing this before there had been any federal level set around this, and where, although they haven't made this that formal, informally they've been making announcements about states that are on the red list, and that's actually defined pretty much exactly the way we did it. They instead said places that are having more than 100 cases per 7 days per population. So that's like 15 times 7, right? Which would be 105 cases. So actually the 22 states on the red list for the federal level are the same 22 states on our quarantine list. So I was very pleased to see that, because we were a little bit ahead there in terms of really making some assessments and decisions about where we considered the outbreak to be in good control. And then actually it came around that is broadly what folks are using.
Got it. I'm going to squeeze this little question in because it is related to the one you just answered, even though we're getting close to time. So this is the last question from Chef Carla on Facebook. Why is Illinois included in the list of quarantine states for New York?
Yeah, right. So out east, they're doing the best from a COVID control perspective. They had the biggest outbreak the first time around. I think people took it really seriously there. They also honestly have not opened as much. Like in New York City, they don't have restaurants open. They don't have a lot of other things open. In that context, they remain in the best control. And so they have actually set their quarantine limit at 10 cases per 100,000 per day. And so, whereas ours is at 15. And that's because they're in better control partly, and that's just the decision they made. So that means that the state of Illinois is up to about 12, actually, cases per 100,000. It's been on the increase. We're watching it closely. Chicago is doing better than most of the state, but we are still, we're over 10 now, so we're not feeling great about it. And the decision is made at the state level. So we were right. You can't go to really most of those East Coast places at this point because Illinois is over 10. And on the map that we have on our dashboard, all of those states in yellow, which at this point would be, I don't have the math in front of me, but it's probably pushing 40 states. It's 30-something states. Would include Illinois, would include the state of Washington, would include Indiana, would include really many, many states. All of those are requiring quarantine in New York, New Jersey, Connecticut, Maine, et cetera.
Okay. All right. We got through a lot of questions today.
A lot of questions.
A little bit of time for good stuff. What do you have?
So one just piece of good news is that we continue to see good progress on vaccines. So pretty much every week or so, there's another vaccine candidate that's showing some promising results as they're doing their safety trials and their efficacy trials. Additional vaccines moving into that phase 3 of testing. Phase 3 is the big deal. That's where, phase 1 is a few people. Phase 2 is, might be a few hundred people. Phase 3 is where we're talking thousands of people. And that's our gold standard for understanding how a vaccine works.
And we have a couple of those trials here in Chicago.
We have a couple of those going, one at the University of Illinois at Chicago, one at Northwestern. But just I've been pleased to see progress there with all of the appropriate safety and efficacy things in place. So I'm happy to see that. Also, I just wanted to highlight that our city-sponsored testing sites are doing very well also. We've partnered with CORE, Community Organized Relief Effort, and we have 4 static, we call them, so sort of up all the time testing sites for COVID-19 that are open Monday through Friday, 10 to 4. Those are drive-through, those are walk-up. Those all have people hired from community. So no concerns around language. People speak Spanish, people speak English, people speak other things, and we've really worked to try to make this accessible. You can make appointments online. They are free. There's not a requirement around, we don't ask anything about immigration status. We don't ask anything around insurance. We don't require ID. So just letting you know that those in the neighborhoods where we're especially seeing concern are up. And then we're doing pop-up testing every week to move pop-up sites to where areas of concern are. So our turnaround time has been good. Just that's been going well.
And you can go to the website.
Chi.gov/COVID testing is where you can see information about that, or as always, after the coronavirus page. And then the last thing I'll mention is that CDPH is offering no-cost vaccines for families throughout the month of August. Not COVID vaccines, but some of the catch-up vaccines that perhaps students or children may have missed while school was out and you weren't, bringing the kids to the pediatrician and all of this. We are doing a back-to-school type vaccination, even though CPS won't be in person. And so I encourage you to do that through your pediatrician's office, but otherwise you can make an appointment free of cost with the Chicago Department of Public Health. We have what's called our care van that goes out around the city. Because of COVID, we are having people make appointments for this. So, but vaccinations will be at different schools around the city, even if the school isn't open. So you can go to chicago.gov/health. That's the CDPH website. You can look at CDPH's social media. You can call 312-746-9096, and we will help get that scheduled for you. So please get your kids caught up on your vaccines. Now is a good time to do it while we're in pretty good control. And I don't want us falling behind more than we have already. I want us to catch back up on the routine vaccinations.
Yep. Time to get into those offices. They're open now.
They are.
Yep. Okay. Well, thank you for being with us. We'll be back again on Tuesday.
We will.
And I also want to say that you answer questions all the time.
I do.
So the frequently asked questions that come in, you can still post your questions in between now and Tuesday, and Dr. Arwady is posting on some of those questions that come up.
And we've been actually having somebody also answer those in Spanish and working on translating those and getting those out. Again, really working to, especially among Latinx Chicagoans, just wanting to get the word out really well. And so please, share our social media, share ideas that you have with us for how to get good information out. And thanks for everything everybody's doing.
Yeah, we got to bend that curve
We
again.
We do. We can do
so
it.
Think twice when you leave your home, and think twice again inside your home too, if you're moving around quite a bit.
Yeah. So thanks very much. Be safe, Chicago.